Thank you very much, Madam Chair. I'm pleased to have been invited once again by Caoh to present. Last year, I presented as well, and this time it's always a privilege to be part of the Caoh family. Right, so on behalf of our director, Dr. Carissa Etienne, I would like to bring greetings from PAHO WHO, and we're very much pleased to be here once again today. I'd like to acknowledge my colleague, Dr. Taralyn Malcolm, who's our NCD advisor. Taralyn, please stand up to be acknowledged. Yeah, she's our new NCD advisor with coverage for Trinidad and Tobago, Guyana, and Suriname, but based here in Trinidad. She helped me prepare this presentation, so my gratitude to her. All right, so I've been asked by Marissa to talk about this topic, and we just find it very, very timely, especially as we talk about the Sustainable Development Goals, which all of the member states are actually aiming for. So I'd like to put into context the role of oncology and your contribution towards attaining the Sustainable Development Goals. So on my outline for today, we'll have to do, I'm going to share some statistics on NCDs in the region and in the Caribbean, the NCD Global and Regional Agenda, cancer-specific information, what are the required actions, and what is the way forward. So why do NCDs matter globally? If you look at this, is this working? No? Okay. If you look at the graph, the middle ones, right? So if you look at the red bars, they represent NCDs. And in 2014, more than 14 million people died from NCDs between the ages of 30, and 69, which is your productive age group. So this is actually, this is the premature deaths that could have been prevented. And these are the premature deaths that really do have an impact on the development of countries and the global development as well. That is why NCDs are such a major issue when it comes to the Sustainable Development Goals. So the burden of NCDs in the Caribbean, 3 out of 4 people die from NCDs, 39,460 were deaths coming from out of NCDs, and 77% of all deaths are from NCDs. 40% of NCD deaths are premature, right? So these are the deaths between 30 to 69 years. So we consider them premature, and if you look at the burden, it's 40%. So this is the figure that could have been prevented. And if you look at the the causes of death by types of NCDs, the first one is cardiovascular diseases at 41%, followed by malignant neoplasms at 23%. That is why the oncology, your sector has a very big role to play when it comes to addressing NCD issues, because if you look at these figures alone, malignant neoplasms constitute 23% of the burden of NCDs in the Caribbean. Okay, let me go back. And if you look at the bars again, the one that you find on the leftmost is the one on non-Latin Caribbean. And you will see here that the Caribbean has the highest death rates from NCDs. So this meeting is really very timely, because you're actually addressing one of the most pressing concerns in the Caribbean. And you will see here that this region has the highest death rates from NCDs compared to all the other regions in the world. The Caribbean also has the highest premature mortality from NCDs. And if you look at the average in the region of the Americas, it's 15.6%. But the premature mortality from the Caribbean is higher at 19.3%. Again, just just bringing home the point of the importance of addressing NCDs in this region. And in terms of population affected by NCDs, you will see the blue bars have to do with diabetes, hypertension for the orange bars, and overweight and obesity for the red bars. And you will see that across the Caribbean, these are all major issues, including Trinidad and Tobago. You will see the Bahamas at the highest there, followed by Antigua and Barbuda, Barbados, and you will find Trinidad and Tobago as well among the top countries affected by NCDs. Okay, so again, further statistics in the cancer in the region is the second leading cause of death in the Americas, as I showed earlier, responsible for 1.3 million deaths in 2012, of which 47% occurred in Latin America and the Caribbean. The number of cancer deaths in the Americas is projected to almost double by 2030 to 2.1 million deaths. So if nothing is done today, and I'm glad that you're doing something about it, it is projected that the number of cancer deaths in the Americas will double. And it's really pleasing to see that a lot of movement is going on here in the Caribbean in terms of addressing this very issue. And about a third of all cancer cases could be prevented by reducing the key risk factors. And that is why this talk had to also do with the prevention, because I know a lot of you are involved in the treatment and the care. However, what is your role in the prevention? What is your role so that the patients don't even come to you for care and treatment, right? So that's a challenge that we're actually faced with. So that when you look at the risk factors now, these are all shared, and we all know this. Everyone, I think, in the room knows this, but it's just to highlight the point that tobacco use, unhealthy diets, physical inactivity, harmful use of alcohol are all risk factors to cardiovascular diseases, cancers, diabetes, and for tobacco use, chronic respiratory diseases, which means that if we impact on the behavior that it's causing these lifestyle diseases, then we are able to prevent these NCDs from becoming the burden that it is now and becoming much more so in the coming years. So there's been a lot of political commitment for NCDs and cancer. In 2005, there was a World Health Assembly resolution on cancer prevention and control. In 2011, but before that, let me tell you that in this very city, Port of Spain, there was what you call the there was the high-level government meeting of the CARICOM on the Port of Spain Declaration in 2007. This was the first ever declaration that actually propelled the UN in 2011 to have a high-level political declaration on NCDs. So you are treading on hallowed ground, actually. So Port of Spain was instrumental in bringing the issue, and the Port of Spain and the rest of the Caribbean region was instrumental in bringing to the global stage the issue of NCDs through the UN high-level meeting in New York, right? So it is, again, it's very pleasing to see all of you gathered here working on guidelines, because this is where all the action started in terms of the movement, the global movement against NCDs. In 2013, there was a global monitoring framework on NCDs. PAHO also developed the regional plan of action on NCDs. 2014, the resolution on universal health coverage and palliative care resolution from the World Health Assembly. And in 2017, the resolution on cancer prevention and control from the World Health Assembly. So there's been a lot of global movement, and seeing this process happening in the Caribbean is really very, very a right step towards achieving our common objectives. And this is just to show you the global monitoring framework for NCDs, which includes 9 targets and 25 indicators. So you will see that one target has to do with mortality and morbidity, which is 25% reduction of premature mortality, looking at chronic diseases and cancer. And then there are also several targets on risk factors, which have to do with behavioral and biological. So 10% reduction of the harmful use of alcohol, 10% reduction of physical inactivity, so on and so forth, including the national system's response. 50% coverage for drug therapy, and 80% coverage for essential medicines and basic technology. And you will see here, number 25 among the indicators for national systems response is cervical cancer screening, and also you will also see hepatitis B vaccines, HPV vaccines, right? So I think these are some of the things you're actually working on, and again, in trying to achieve the global targets, you're actually contributing towards these global targets, just to put things in perspective. Right, again, putting things in perspective, I was telling you about how this whole movement in addressing NCDs is part of the whole global movement towards achieving sustainable development goals by 2030. If you look at SDG 3, it has to do with good health and well-being. And SDG 3 has 13 targets. And you will see here, related to NCDs, 3.4, reduce mortality due to NCD and improve mental health. 3.5, strengthen prevention and treatment of substance abuse, including narcotics and alcohol. Reduce mortality due to road traffic injuries, and strengthen implementation of the Framework Convention on Tobacco Control. And there are all the others. And let me highlight as well 3.8, which is achieving universal health coverage. Because working for NCDs is actually working towards achieving universal health coverage. And by strengthening health systems as well, to respond to NCDs is working towards SDG 3. Okay, so I just want to also highlight, the interconnectivities, how all these different targets are actually linked to each other. And also, let me just go back here, how health and well-being is actually linked to all the other SDG targets as well. The thing is, we recognize that in health, a lot of things that impact on health are actually outside of health. We are at the receiving end of the unhealthy behaviors. We are at the receiving end of all the risk factors, of all the social determinants that impact on health, right? So it's important that even while we talk about the role of the health sector, we need to also think about our role outside of the health sector, and how we can collaborate with the sectors outside of health to be able to impact on the risk factors. So why are NCDs relevant to SDGs? Just to reiterate the point, we acknowledge that the global burden and threat of NCDs constitutes one of the major challenges for sustainable development in the 21st century. And the WHO Global Coordination Mechanism and NCDs acknowledges the interrelated roles of non-state actors, the UN agencies, and the member states. We were just talking about on the side earlier with Dr. Anderson regarding the role of the member states. It's the member states that actually direct in health organizations like PAHO and the WHO in terms of what direction the Secretariat should undertake. And it's the member states themselves who determine the direction for where they want to bring their health system. So what are some of the 5 functions? What are the 5 functions of the coordinating mechanism? Advocacy, raising awareness, disseminating knowledge, encouraging innovation, advancing multi-sectoral action, and advocating for mobilization of resources. And the PAHO Regional Plan of Action has 4 lines of action. And the goal is 15% reduction in premature NCD mortality by 2019. There are 4 lines of action or objectives. One is to create multi-sectoral policies and partnerships, acknowledging that it's not only health that can address NCDs, but we need to integrate policies outside of health. Develop and revise national NCD plans and include NCDs in universal health coverage, as I mentioned earlier. The approach, what we call the approach towards the sustainable development, the social determinants of health, which is what we call the health in all policies approach. The health in all policies approach means that when sectors outside of health would start to think about policies, they need to think about the health impact of the policies that they're developing. And the health sector should be part of the conversation in these other sectors, so that when these policies are actually developed, that they're cognizant, of their impact on health and how health issues could actually be addressed as they are developing the policies, right? So objective 2 is the reduction of the prevalence of NCD risk factors, has to do with tobacco use, harmful use of alcohol, healthy eating, and active living. Objective 3 is improving coverage, access, and quality of care for NCD management, looking at the chronic care model, medicines and technologies, and intervention for NCD screening, treatment, and control. Objective 4 has to do with NCD surveillance and research is very important. And looking at NCD and risk factors for surveillance systems. I just would like to share to you that Trinidad and Tobago just completed their global school health survey and the global youth tobacco survey, which both incorporate surveillance for NCDs, right? And they're going to be doing the steps as well. So there's a lot of surveillance going on so that you're able to track the progress. Because as we said, if you cannot measure, then you cannot manage. So surveillance is important in establishing the progress and of where things are at in terms of achieving the objectives. Objective 4 has to do with exactly that, the surveillance systems, and of course the utilization of data for planning, monitoring, and evaluation. So now talking about time-bound commitments in terms of NCD management. We're hoping that by 2016, which is past already, it's to strengthen health systems to address NCDs through people-centered primary health care and universal health coverage. And the indicators are evidence-based guidelines for NCD management and drug therapy, including glycemic control for persons at high risk to prevent heart attacks. Okay, so again, you're gathered here today and working on these, the guidelines for cancer is really working towards developing those NCD guidelines as well. Let me tell you that next week, here in Trinidad, we're going to have a big symposium on strengthening primary health care towards strengthening the health sector response to NCDs. This is going to be held at the Hilton. And the reason why we're having this is we want to sensitize once again the country in terms of the role of primary health care. The Alma Ata Declaration is celebrating its 40th anniversary, right? While things have changed, in 1978, it was more communicable diseases. Now it's NCDs. What we found out is that the approach remains to be relevant, right? And so therefore, we're still using the primary health care approach in terms of addressing NCDs by strengthening the health system response. I'm getting the time. So let me just go through this very quickly now. So there's a regional framework for NCD prevention and control. We are also saying that even in the UN Multi-Country Sustainable Development Framework in the Caribbean, the Healthy Caribbean involves work on NCDs as well. All right? Okay, so I think this is where I want to highlight the role of oncology. Because a lot of you might be involved in the pink side, right? The advanced cancer and the terminal cancer and the early cancer may be here. But what we're really trying to do is for people not to get to that stage. So I think what we need to have a focus on is health promotion and primary prevention, ensuring that the population remains healthy. and those that are exposed to risk, the risks are mitigated. All right? So, there's a, okay. Sorry. All right. So, okay, I have my cue now to stop. So these are some of in terms of cancer program management and evaluation, they have several components: cancer prevention, screening and early detection, diagnosis and treatment, palliative care. Okay, let me just move quickly, just to show you that some of the WHO guides for effective programs. So we don't have to start from scratch. A lot of the guidelines are actually in place already. This is the WHO Cancer Control Framework, and you can see here the National Cancer Control Programs. And these are the PAHO areas of work in cancer. And we also have the PAHO Strategic Fund, where there's pooled procurement for essential medicines at a lower cost. And that is assured of quality because they are WHO pre-qualified. And we have a number of them in the PAHO Strategic Fund. And this is showing the differential in the differential costs. So what are the challenges of cancer programs in Latin America? All of these things: public health priorities, health system barriers, technology, sociocultural factors. And these are some of the key principles in cancer control programs. And the way forward, these are some of the actions that the member states are doing. And if you look here, strengthen the competencies and skills of health providers and public health professionals. This is very, very important. And this is the best buys in terms of intervention to address NCDs. And you know all of these, right? So you know the best buys. And these are the actions for intergovernmental partners and non-state actors support the national authority in strengthening the healthcare system, in efforts to improve access to affordable, safe, effective, quality medicines. And in conclusion, I'd like to say that strong political leadership in the Caribbean has actually mobilized the global response to NCDs, as I mentioned earlier. It is here in this very city that propelled the global attention to NCDs. However, the poor uptake of public health interventions to reduce NCDs remain to be a challenge, and the progress towards NCD management needs to be prioritized, therefore. And thank you very much for coming together to help the Caribbean address the issue of cancer towards achieving our collective goals towards addressing NCDs. Thank you very much.